There's so many benefits to the pump, and you have to be able to walk through, what does this mean for them? But I've generally found that that's the case too, because this really is it's a family process that they go through. The patient is facing it, but also as you said, oftentimes the adult children who are caregivers, and getting buy-in from all of them is it's so important. And they're looking for help.
Absolutely. These are patients who, as you say, they're in a very vulnerable time in their lives, and you want to make sure that you're not coming across as mercenary, I guess, is one of the things to say here. I mean, you have to say it because it is something, it's a procedure that you're doing that you're getting paid to do. So there could be a perception that you're just doing this to try and make some money off of this patient. I think there's enough data out there about the effectiveness of pumps and enough other patients who have gotten really good results from these pumps that is not the case. I mean, you're not doing this for yourself is the bottom line. You're doing this because you can make their life better by putting a pump in them. For whatever time they've got left, whether it's, a year or 6 years or whatever time they've got left, if they can spend that time not being loopy, not being constipated, that is time well spent. Whatever effort and difficulty you've had to go through to get them to that point is absolutely worth it. Because, I mean, just to get personal here, my grandmother died of colon cancer when I was just 3 or 4. And I remember my dad talking to me about times when he would hear her sobbing to my grandpa, "Why can't I just die?" Because the pain was so bad. People living in pain are not living. They have a horrendous time of it. So whatever we can do to control that pain, I think is absolutely worth it.
That was fantastic. Thank you for sharing that, Glade. And what a powerful example, and something that happens very frequently for a lot of these patients living with cancer that is painful for whatever reason. It's chronic opioids, as you said, oral opioids, living with loopiness, not really being engaged with the time left they have. So you really spelled out so many of the benefits there. I think that anyone who's listening who doesn't yet see the benefit of the pumps, just go back and re-listen and come back. But you've really well outlined how this is a complementary approach to the bone tumor ablation. And so I want to draw it back to that to the bone tumor ablation. We'll talk a little bit about some of the specifics. We've talked some great pearls about practice building, how to approach collaboration with other specialties. Now let's talk just technical details. So as you said, you pretty much do these in the office-based setting. Is that correct?
Yep.
Yeah.
I'm doing them under fluoroscopy. Basically what I'll do is we'll work up the patient, we'll look at their imaging, make sure that that we know where in the vertebral body the tumor is, because we're going to try to make sure that we cover that part of the vertebral body with our ablation. If it's off to the left side, then we're kind of going to cheat to the left, that kind of thing. We make sure that we know where the fracture line is, because filling the fracture line is the key with these cases. If the fracture line's at the top of the vertebral body, we want to make sure that we're getting cement into that fracture line so that we can actually treat their pain. We want to take a look at the pedicles and make sure that we know if we're going to have to burn the pedicles on the way out, because if the pedicle is involved and you don't treat it, you may leave them with persistent bone pain, and that's no bueno. One thing to keep in mind is that the pain-generating part is not the center of the tumor. It's the interface between the tumor and the bone. So you want to make sure that whatever you're doing, you're burning the bone-tumor interface, because that's where the evil humors are being released that are causing pain. I'm using the term evil humors tongue-in-cheek, but there's a couple of things that happen. One is there are nerves inside the bone that get directly invaded by the tumor. One is the tumor creates an acidic environment, which tends to sensitize the nerves in that area, and it causes it to be more painful. And then you get the pathologic fractures. And those are all reasons why bone tumors are hurt.
Absolutely. It's a really important point, because especially when I was back in diagnostic radiology residency, where there was kind of this notion that floated around. It's like, oh yeah, this patient's got bone mets, but they don't have a pathologic fracture, so they probably don't have pain. It's just nonsense. As you said, there's multiple different pain generators there. And as you said, the edge of the bone tumor interface is really important.